Welcome back. In the first part of this episode, we talked about the types of diabetes. So in this part, we will expand more over on the juvenile diabetes. And with that, we have Dr. Fahad Jaser, a pediatric consultant, endocrinologist, and diabetologist. Hello, Dr. Fahad.
Hello, good afternoon, and thank you for the invitation.
You're most welcome, Dr. Fahad. Welcome to Medipedia.
Thank you.
So, Dr. Fahad, let's go through to the topic immediately. So, can you tell us about the symptoms for a child who is diabetic?
Yeah, so usually, as we know nowadays, we see a lot of kids with specifically type 1 diabetes.
Yeah.
So when we talk about the symptoms and when we educate parents and family and the public about the symptoms, we always stress on if the kid is having increased thirst, intense thirst. I know nowadays it's summer, so sometimes it's really hard to figure out if the child is thirsty because of the weather or because he really needs some water or some other drinks. But how to differentiate between it is that the kids will regularly or more often every 10 or 15 minutes will go and grab a bottle of water, for example. The other symptoms is going to the washroom all the time, and mostly it's found in gatherings. You will notice that some of the uncles, aunts will notice that the child is going to the bathroom every 10 to 15 minutes. The third symptom is losing weight and losing energy. So whenever these symptoms occur in a child, please take him directly to the ER department next to your home.
Well, it's not that easy,
Yeah.
Because sometimes, especially with kids, you cannot notice them, you cannot observe them or follow them all the time. You wouldn't know all the details, what they're doing.
You wouldn't, and if the parents are slightly ignorant or not really educated, they wouldn't, unfortunately. They will not notice it.
Yeah, exactly. And that's why we're trying to do a lot of campaigns just to figure out those symptoms and to explain it in simple terms. But you know what? I mean, on the positive side, nowadays, especially in the Middle East and MENA region, people are more educated now about the symptoms.
Thank God.
So we're not seeing as much severe cases as before.
That's a good thing.
That's amazing. That's good.
Yeah. So, Dr. Fahad, we talked in the previous segment about how kids now can have either juvenile diabetes or acquired diabetes, even though they are kids. So, could you tell us more about that? Which percentage is higher?
All right. That's actually a very good question. Kids, when we categorize kids, and when we mean by kids or children, according to the WHO, which is the World Health Organization, any person under the age of 18 is considered a child.
Oh,
yes.
I thought it's 12.
No,
I
it's
know.
18.
Some of them are adolescents or adults,
Yeah.
but we still consider them children.
Yeah.
Yes.
So we categorize diabetes into 4 types. Type 1, which is the commonest. More than 90% of kids who are diagnosed with diabetes are type 1, and these kids are dependent on insulin. Comes after it is type 2, which we see now more often because of the obesity and the sedentary life activity or lifestyle.
Yeah.
The third type is what we call it MODY, or genetic cause. So this is what we call it, a single gene of diabetes is causing it. And this is what we usually see in the neonatal diabetes. So kids are usually born with it. But this is a very small segment of diabetes in kids. And the fourth type, we call it other types, which is related to medication, for example.
Right. Okay.
Dr. Fahad,
But
back
the commonest, if I want to just stress on one point, the commonest type is type 1.
Yeah.
Right. Okay.
And Dr. Fahad, back in the day during my clinic, I had a major problem sometimes explaining medical issues or my treatment to kids. So can you tell us from your experience, how did you tell or tell the kids about their type 1, for example, if they're diabetic? How do you explain it? How do you tell them?
Yeah. So again, an excellent question. So when we talk to kids, we have to be very simple. We have to, of course, it depends what is the age that we're dealing with, depending on the cognitive function of that kid. Specifically, some kids have special needs as well. So we have to be very careful with the age that we're dealing with. With kids, you have to be very simple with your words. You have to use verbal and non-verbal communication, and you have to explain it in a way that is very understandable and makes it less traumatic to the kids.
Yeah.
So we have different way of doing that. Due to the program, I cannot explain it in detail, but we stick with each category of those kids depending on their cognitive level.
Okay.
Wow.
Fair enough.
That's amazing, Dr. Fahad. Thank you for the lovely information. Actually, I wish it didn't end. But thank you in the end. Thank you a lot, Dr. Fahad Jaser, pediatric consultant and endocrinologist. Thank you so much. Dear viewers, let's have a small break and we will back. Stay tuned.